Welcome to Community Roundtable. I'm Nick Burns from the Salt Lake Community College Division of Communication and Performing Arts, and I'm your host as we explore topics of special interest and special concern to the residents of the cities and to the unincorporated areas of Salt Lake County. And these are topics we believe are equally important to the general public throughout all the state of Utah. And today on Community Roundtable, we're going to talk about getting older. I know it's happening to me. I know it's happening to you. The Utah Commission on Aging is housed at the University of Utah's Center on Aging, and the Commission is involved in issues ranging from policy and demographic shifts to getting ourselves ready for the graying of Utah. We'll discuss the shadows of life, and we'll investigate how to stay young when you're getting old. It's all a part of intelligent aging today on Community Roundtable. And joining us, he is the Executive Director of the Utah Commission on Aging, Rob Ence. Thanks for being here.
Thank you, Nick. Nice to be here.
And you were on the show years ago when you were with AARP.
That is correct.
And now you're with the state. So same job, different job?
Well, it's a different framework, but it's still in the aging industry. 10 years as state director in Utah, and then I served 5 years as the West Regional Vice President for AARP. So I saw a lot in the country.
Yeah. We have an aging industry beyond meds?
I call it an industry because clearly there are so many services and organizations who are involved and should be engaged in helping us with the aging process that there's sort of an indirect agency and industry nature to it.
Okay. So Utah Commission on Aging, why do we need a commission?
Sure. Well, back in 2005, Governor Huntsman, along with Senator Pat Jones and others from the legislature, created the commission because there was the Utah 2030 project, and it was to study the demographics of the aging society and the increasing numbers of the older population. We wanted to make sure that the state agencies understood, were prepared, and that we had public education information so that families could prepare for the things that would impact them individually, as well as the services in the state and municipalities would be prepared as well.
Okay, because everyone always thinks of Utah, you know, we're famous for our kids.
Correct.
But yet,
changed.
Yet it's changed. So I mean, this is not only age, but there's race, culture, religion. I mean, there's all kinds of changes that are tied up in people getting older. And
that's absolutely true. And every culture, every ethnic group treats aging a little bit differently. And so there's a challenge to make sure that the preparation reaches all the cultural communities in our state. And you mentioned the fact that we had a large population of youth. The pyramid has changed, and that's what's so dramatic about what we're seeing in Utah, not only through 2030, but also going out to 2050. At a time when the normal aging pyramid would look like this, now you're seeing that between the years 2030 and 2050, it actually inverts, and the largest and most rapid growth comes with the 85 plus population, and will catch up in numbers. And so you'll end up having a dependency ratio where you'll have one person in the workforce for every one person who's out of the workforce.
I mean, countries like Japan are facing this already.
Correct, and they have a different way of handling some of these things where a lot of times families stay together and they age in place in the homes of their children.
So thinking of issues here along the Wasatch Front, a lot of families tend to stay close. Maybe people don't move away quite as far as they do. What's unique about seniors here compared to other states or the Intermountain West?
Sure. The challenges are similar, but I think one of the things Utah has going for it is that we actually have a lower occupancy rate, for example, in institutionalized care, nursing homes. We have larger families who tend to take care where they can of individuals staying in the home. If you look at the economic benefit to the state for caregivers, it's probably $4 billion a year in actual revenue equivalency, where people spend their own time taking care of loved ones in a home. So that's a big difference in Utah, is the fact that we have an enormous support base through religious circles as well as family circles.
I mean, that's a huge shift right there when the kids become the parents.
That's right. We have a lot of folks in their 40 to 60-year-old that are not only taking care of kids still, but are also starting to take care of aging parents.
And we can't go there today, but you've got the kids in the basement, right?
Yes.
And then you've got the grandparents upstairs?
That's correct.
I mean, that's a huge stressor on those 40 to 60-year-old folks.
And one of the challenges we have in our public policy arena is helping figure out how we provide appropriate respite for people who are literally spending all that time caregiving. And we don't really have enough resources dedicated or services allowing folks to get a break from that enormous stress.
Okay, so I want to get back to that, but speaking of maybe people who are younger, here you are at the University of Utah Center on Aging.
Correct.
So at a university, I mean, are the old folks the guinea pigs? Are they research topics? Are you trying to get old folks to come back to college? I mean, what's with having this commission housed at a research institution?
The commission originally started as part of the Department of Human Services in the state. And Governor Huntsman moved it approximately 2007, 2008 to the University of Utah to be part of the Center on Aging, which was newly formed. And it included geriatrics, it included the College of Nursing and the interdisciplinary program related to gerontology, and also a collaboration with a lot of the different individuals who have an interest in aging, from folks who run the Brain Institute, from people who work in the architecture department, just creating housing and community issues. So it became a logical place for the commission to reside. But it's really not a position necessarily with the university. It's a hybrid role between, it's an appointment by the governor, but has a responsibility to the state and to bring academia and research connecting to the community.
I mean, that's huge. I mean, you're talking about healthcare, housing design, livability, air quality.
Correct.
Family dynamics, communication, consumerism.
All of those things.
I mean,
and that's the advantage of being part of the university, is that you're really at a very, it's a sweet spot to be able to help facilitate and coordinate the services, whether they be governmental or the research available through institutions or the many, many agencies that serve the public. And the job is to create good collaborations and to make sure the public has a good understanding of what's available to them, as well as what needs to be done to address the issues of the future.
The people doing this research up at the U, fair to say they're among this boomer population as well, or do we have younger researchers looking into the elderly?
Across the spectrum.
Interesting.
We have individuals who are coming into the school and being offered programs in undergraduate master's degrees with specific studies around the aging issue in gerontology. We have programs that are designed to help those in the medical provider industry develop specialties in geriatrics, where we haven't had a lot of time spent on that. And there's some just unique issues dealing with that extra training and some focus in the curriculum will help create providers for the future. So there's a shortage.
Okay, good point. Probably
Yes.
is from hospice care on down shortage or on
Absolutely.
up. What about money for the commission? Does the university kick in as well, or this is funded through the legislature?
Initially, money came from the legislature, just an amount to provide for minimal staffing, and then the commission does also participate in some grant acquisition. But primarily, there have been a little bit of few funds from the university over the years as well. Going forward, the commission's just been renewed for 10 years, which is a good thing. And
Thank you, because I'm going to be here.
And now we have appropriations, though, we do have to deal with. And so there is a strategic effort right now to figure out the most appropriate way to fund it. And yes, some seed money from the legislature is required in order for us to fulfill our mission.
Yeah, I mean, somebody has to pay your salary.
Well, yes, it's modest.
Modest, well, it's Utah. The university's giving you space, so they're providing in kind that way.
That's absolutely
but
right.
not operating funds per se.
That's right.
Interesting.
Yes.
So we're going to take a break. When we come back, I'm totally fascinated by this connection between higher ed and the elderly, because I know we have lots of students here at Salt Lake Community College who are non-traditional, who are older themselves.
Yes.
So I want to let this bleed out into the larger academic community when we come back.
Sounds good.
Join us, stay with us, keep with us. We're talking about the elderly and growing older in Utah here on Community Roundtable. We'll be right back.
Good. Trying to connect with all those folks.
We are back on Community Roundtable talking with Rob Ence, who is the Executive Director of the Utah Commission on Aging. Thank you for being here. When we left off, we were talking about how this commission is housed up at the University of Utah. You have all these advantages, all these anxious researchers, all these different areas of study. But here we are at the community college, and I wonder about the elderly here. I mean, we have plenty of older students, we have plenty of people looking for retraining, we have plenty of people looking for just continuing education. So how does the commission's work sort of spread out to higher education all across the state?
Well, you highlighted why older students might be at the college, and I think a really critical thing to keep in mind is that individuals aren't retiring as early as they once were. And so out of economic necessity, they need to re-career. They need to change their educational focus, and so that they can stay active and vibrant in the workplace. And then there are those who just simply want to keep active and keep their minds alive and do things that will enrich their lives and those around them. So there is a really important place for colleges and advanced learning, continued learning for older individuals.
So when people get, I mean, they're sort of, I think of stages of elderliness, right? That you get to be 55, 60, 65 years old, maybe it's time to like, well, have I done anything I want to do, right? You're thinking about not working, or you have to continue working. But then eventually people tend to reach a place where, like, what am I going to do here at the end, kind of? You know, do I want to read to school kids? Do I want to volunteer at some other senior center? And I wonder how the Commission on Aging is helping old folks sort of in their daily lives in terms of giving back.
Right. All of those are really good examples. Volunteering is a huge thing, particularly in Utah. We're one of the huge volunteer states in the country. But I think just the fact that if people stay active, if they stay learning, their lives will be much more vibrant. They're less apt to be isolated and lose their sociality. They stay connected with new people and new challenges. You know, we have multiple senior centers around the state, and they really only service perhaps maybe 9 or 10% of the population over age 65. So there's a large group out there that needs to know that there are opportunities to connect and to engage in the universities and the college campuses. Really provide a really unique and special opportunity for people to be able to do that. Another thing that's really important is this issue of adult literacy. We have a large percentage of our population, not 50%, but clearly about 20%, who struggle with adequacy with English, or struggle with adequacy of understanding basic things. We want to make sure that people can interpret the options available to them. And coming to school really helps them grasp a basic understanding, so that when they read a prescription bottle, they understand what the prescription actually means. They can deal with it. Or if they're trying to evaluate services, do they understand what guardianship is, or advanced care directives, or you know what a pulse is. All those things that people have to make decisions about. It helps to have a certain amount of literacy on financial issues as well as health issues, and the college campuses can really help with that.
I mean, it seems like those children who are now the caretaker, the children who are becoming the parents, they need to be able to read the bottles,
yes,
right, and understand a living will.
That's right.
I mean, it's almost like you need a class that's for the whole family.
That goes back to the comment about industry. You know, you have medical language and you have government language. The aging industry has its own language and lots of acronyms. And so there is a literacy for even those who are caregiving to be able to understand how to navigate the services and to know what's available and how to interpret it.
I mean, you need a PhD to be on Medicaid or Medicare, really. I mean, it's insane.
It feels that way, I'm sure, at times.
So, you mentioned this notion of adult literacy and being able to read a prescription bottle, but what else do you see that needs working on now for seniors in Utah? What else should we be doing today, or what is the Commission doing today?
I think that working in collaborations with folks who have some great ideas about creative aging, involving older individuals in the arts, everything from acting and singing to paints and recognition. I think that the programs that can really make their lives vibrant and try new things enhances their ability to stay sharp. And you know, if you learn to play a new musical instrument, again, it deals with keeping your brain ready and in tune, but at the same time connects you with people. And connecting with people is a really big deal as we age.
I mean, aren't there statistics on that old folks who live alone tend to die younger, sooner, etc.?
That's correct. It also applies for people who retire too quickly. If you lose your engagement.
Retire too quickly?
Yes.
You mean too young?
Too young. There are data out there that indicate that vibrant lives and longevity have a lot to do with staying involved. And it doesn't necessarily mean you have to stay with the same job, but just whether it's volunteering or actively being engaged in a community has a lot to do with your body sustaining.
So I should think about retiring from here and then like work part-time at Home Depot in the electrical section?
Whatever you love to do, find your new passion.
No, but I mean, what you're talking about is something that I was reading about the other day, intelligent aging.
Yes.
And you know, some people think that's plastic surgery, but it's not really, it's a little bit more than that.
Yeah, the intelligent aging is actually a phrase I coined that borrows from the concept of business intelligence, which takes raw data and makes it into actionable information.
Okay.
So we deal with all this research, and the challenge for the Commission is through the collaborating partners in the communities. How do we take this information and actually make it actionable on things that touch the lives of individuals that it impacts, whether it's the caregivers or the people who are aging or dealing with difficult decisions at end of life. Any stage, this intelligent aging is to help them make the best decisions with the right kind of information.
So the commission has to be involved in making sure the information's out there.
Absolutely.
And it's accurate, and people aren't going to, abc.com scam, etc.
Yes.
I mean, that's a huge project.
It is indeed. And it is one of the mandates of the charter for creating the commission is public education.
Yeah.
And in addition to that, it's educating the legislators. And we need to be the honest broker for the legislature to make sure that we have public policy that eliminates barriers to successful aging, whether it's rules in terms of how we construct our sidewalks and mobility and transportation in our communities, to ability to prosecute for exploitation of fraud and finance. There are all kinds of things that unwittingly get in the way from effective prosecution, and our job is to make sure that legislators have the right kind of information. Legislators have the right kind of information.
Successful aging, I mean, is that something that always happens, to you but not to the other people?
Successful aging?
Yeah, I mean, because you'd think a number of our legislators are boomer folks themselves. You think they would be hip to this stuff.
It's an interesting situation when you have your health care taken care of and you have professional careers where some of these things may not be as pointed in their lives. But as soon as they are dealing with an older parent, or they're dealing with a child who becomes dependent with a caregiving issue, it really sharpens their focus on the issues we're talking about. And it's not that I wish those things on anyone, but the reality is, unless you experience it, it's really hard to empathize with the reality of what other people experience.
I mean, healthcare is a really good point, because many seniors Medicare, but then you need the Medicare Advantage.
Correct.
Or if you're really poor and destitute, maybe there's Medicare and Medicaid. But
that's right.
If you're an elected official, there goes that problem.
And I think a lot of people don't understand that Medicare doesn't do everything. It doesn't cover your long-term care needs. And Medicaid, which is, again, partially funded by the federal government but driven by the state, is difficult because people don't completely relate all the time to individuals who, for no fault of their own, have had an injury, an illness, a separation in a marriage, a loss of a job. There are multiple reasons. And if you're dealing from a mindset that I've sort of protected myself and I've got mine, you have to deal with yours, it's a bit narrow. I think that the concept of the commission is to help people understand that we have a responsibility collectively in the state to help each other as we age.
Do you think you're getting there?
I think it's a good start, but I think we have a long way to go yet.
Because, I mean, here we are in the West. Everybody's an individual.
Sure.
The hero rides in, the hero rides out. Obviously, he doesn't need help. He's got his horse. But you're talking about this massive project, and I know we have to take another break. When we come back, I want to get back more into this notion of intelligent aging, because it's more than just not being depressed or keeping your brain active. I
That's
mean,
right.
There's 1,000 other things that people should be thinking about. And
that is right.
I'm almost getting scared here, and I have a good job. So yeah. We'll be right back talking with Rob Ence from the Utah Commission on Aging about growing older in Utah, about what the commission is doing, and about how all of that work helps all of us. Keep it tuned to Community Roundtable. So get used to it.
Yeah,
it's like,
yeah.
Well, wait a minute.
That's our standard expectation.
We are back on Community Roundtable talking about intelligent aging and successful aging. So we talked about, keeping your brain active, staying social, again, getting lost in your own world. I know there's research that for seniors who have pets, that tends to be a way to keep people active, involved. But other issues that I think we touched on only very briefly earlier, but things like diet, things like exercise, how does the commission take on, changing somebody's diet's like changing their religion. That's a huge topic, but yet for many seniors, it's critical.
Behavior modification is a challenge, whether it's for health or whether it's the way you manage your finances, all of those sorts of things. There's an adage that I heard from folks at the Brain Institute said, if it's good for your heart, it's good for your brain. And so if you're taking care of your nutrition and you're getting the exercise, you're not only helping your physical body, but you're also helping the brain center as well. And anything you can do to ward off the effects of aging on your brain health is really critical to a vibrant life.
That should be a slogan for the buses and whatnot. Good for the brain, good for the heart,
yes,
good for the head.
Yes.
That's good. You should use that. You should
I will.
That. So, we talked about living wills, advance directives. Some people are afraid to death to talk to mom and dad about that. Sometimes mom and dad want to talk, sometimes they don't want to talk. It's going to be a big surprise if people don't deal with that. And again, that's something I know you're all working on. But something else that I came across was this notion of people in the shadows of life.
Right.
What do you mean by that?
Well, this actually comes from a phrase, I believe it's attributed to Hubert Humphrey, about the measure of a society is how we care for those in the shadows of life, and it's the youth and the disabled and the elderly. And I think the biggest challenge is it's that comment about how we as a community have an obligation to care for each other. It's not just, the lone healthy individual on the horse that is self-sustaining, because a lot of things can happen to that person that would change that whole dynamic. The reality is we need each other. And our job as a commission is to help people understand how we can be better coalescing, how we can be better not working in silos of our expertise, but rather share information and best practices and really help reach the public in the most effective way so that they have good choices. Going back to this intelligent aging conversation, it's about understanding what's available and how does that apply to my situation.
I mean, it sounds like at heart that's the center of this commission, is how to create collectivism in a society that's massively individualistic.
That's right. You've heard the term collective impact, and collective impact is the heart of the game. There are so many talented individuals, and there are so many goodwill efforts with different groups and associations. They don't always know about each other. They don't always work in concert with each other. And so part of the commission charge is to help facilitate. We have to be aware of what's going on. That's my biggest challenge, is making sure I'm completely aware of what's going on throughout the state and throughout the country, but then help these individuals find ways to work more effectively and efficiently together.
Okay. So a couple minutes left. Seniors facing poverty in Utah, are we better, worse off, same numbers of folks than
Similar
elsewhere?
challenges. We have an approximate 8 to 10% situation where people go to bed hungry every night, over age 65. We have wonderful service like Meals on Wheels that help folks, but again, we're only reaching a sliver of the population with limited resources.
I mean, Meals on Wheels is great if you know to ask for it,
and
if you know how to take advantage,
and
you've got kids to help.
The capacity of the service is it's limited, and it's one of those things about where do you put the dollars available and spend them the most economic way possible. But hunger is an issue.
I'm presuming that if we take care of these little things like feeding people, that would save us all money in the long run, right? Fewer ambulance runs, fewer hospitalizations. So one of your jobs must be the advocacy of it's better to spend money now than spend more later, which I bet's a hard sell.
It is a hard sell. And I think that's part of being the honest broker with the legislature, is to help them understand there are options and there are choices. And if we don't do this, what is it going to cost us over here? It's not always about going with your hand out for money, but it is really helping them and others understand that there are choices. And you're absolutely right that some dollars spent today will yield great investments for tomorrow, or greater costs if we don't.
So a couple other things to talk about. This notion of when people get older, maybe they don't want the house in the suburbs. There's the stairs, there's the big grass, there might be all kinds of reasons, health issues. What about how to navigate those issues, and what's the commission doing for helping people make decisions about where to age?
So a couple of things there. First of all, most of the time people would like to age in place at home, and getting services available and supported so that they have access to those things without necessarily having to be in a nursing home. Assisted living facilities are also an important piece of the formula. But not everybody wants to do that. Some people, there are really very few choices other than that. But where you have services in the home, you have to have home and community-based services to support that. Second thing is, I think there are a lot of creativity going on around creating communities where people come together who desire similar age and similar interests. And you'll see these innovative sort of senior communities evolving where they're working together to sustain each other, support each other.
Like the Sunbirds kind of thing?
Can be.
Retirement communities?
Yes. And
no kids, etc.?
That's correct.
Interesting.
That's correct.
Do you see a movement towards that around here?
There are a few pilot projects popping up in Utah and elsewhere that are demonstrating how this could be one of the options available to folks as they age.
So one problem I see is, staying in your home. I totally get that. But for many folks, they're staying in a home where the neighborhood isn't walkable, there's no bus transportation,
right.
There's no jobs close by. So on the one hand, what you want is probably the least successful thing for you.
There are modifications that can be made to some homes.
Sure.
And sometimes people have to move to a home where services are on the same floor, there's wheelchair access, doorknobs are at the right height. So that universal design concept is something that we ought to be incorporating into our homes as we go. But the whole walkability transportation piece is complicated. It's not easy to solve. Sometimes volunteers can help alleviate some of that by helping with driving and so on. But these are the challenges that are being confronted. There's a World Health Organization move called Age-Friendly Cities, and Salt Lake County, for example, right now is embracing some of their concepts and has an initiative about really focusing on the housing and transportation mobility issues.
Okay. So, a couple minutes left. Successes for the commission? What would you put in the win column for your work?
I think a couple of things that really stand out, particularly on brain health. It's a wonderful program called Music and Memory that's been going on with the Jewish Family Services and the Health Care Association of Utah. We chair that, and it's basically about helping people who have dementia and with music, how it's impacting their quality of their life with custom iPod recordings. That's been a really successful program, about 80 different nursing homes right now. Another one would be the Aging and Disability Center, Resource Center for Veterans, where we were able to bring additional veterans dollars into the state. About 70% of our veterans didn't know they were eligible, particularly in rural areas, for veterans benefits. Last year, in fiscal year of 2015, over $433 million of VA benefits came into the state, and that helps alleviate the coffers for Medicaid and other things.
Good point.
And a lot of that has to do with driving and training our county operatives to offer and help people refer to the services that are available. So it's public education of what's there.
I mean, we keep circling around that, education, education, education.
That's right.
But then you're talking to somebody in education. Last 30 seconds, what haven't you been able to do that you want to get to?
I think the original mandate was a little broader because resources were a challenge. A lot of times strategies were driven by funds available, and what we're really trying to do is get the commission in a much more a higher level posture to be a better collaborator, better convener of these resources, to be a better advisor to the legislature in terms of the public policy issues. And we're going to build out a pretty robust communication strategy with a better web presence, with a better social media connection, so that we're hitting all age levels in the things they have to be thinking about.
Okay. And you're going to keep working, or are you ready to retire?
Oh, no. I'm not anywhere near ready.
Rob, thanks for being here today.
Thank you, Nick.
And come back again when you got more going on at the Commission for Aging.
Be a pleasure to do so.
Thank you. And thank you for joining us on this episode of Community Roundtable. If you have a comment, if you have a question, maybe you have a suggestion for a future show, we'd love to hear from you. Our email address, roundtable@slcctv.com. Keep it tuned to your SLCC TV. I'm Nick Burns.